Shortall, 30 seconds to put your question.
Thank you, Cathaoirleach. This question relates to the background to the nurses' dispute and what transpired in relation to the Public Service Pay Commission. And it's been brought to my attention that a very important sentence from the HSE's submission intended for that commission was edited by your department, Minister. And that sentence is: the overall picture of the nursing and midwifery workforce is one of a constant challenge to effectively recruit and retain to meet ever-increasing service demands. Is this the case, and why did it happen, if so?
Thank you. Firstly, Deputy, I want to clarify that the HSE submission was not to the Public Service Pay Commission, but instead came to the Department of Public Expenditure and Reform through the Department of Health to assist with preparation of a joint employer submission. Secondly, I want to clarify that when requested by the Pay Commission, my department made the HSE internal submission available to them in June of 2018, and it was considered by them in the preparation of their report that was published in September. I understand that both the HSE and the joint employer submissions are available on the website of the Pay Commission. It's long-standing practice that the Department of Public Expenditure and Reform, and before then the Department of Finance, represents the public service as the employer. The Department has the responsibility for coordinating, articulating and submitting the employer case in such matters on behalf of government as an employer. This is absolutely essential in ensuring consistency and coherence in approach. The employer submission compiled by this department is based on data and inputs from a broad range of sources, including materials submitted to the department by both Health and the HSE. It should be said that the joint employer submission to the Pay Commission reflects evidence presented by the HSE, particularly the increase year on year in absolute numbers of nurses and midwives, over and above the level required to simply replace leavers and retirees. Since December of 2013, the public service has now recruited an additional 3,876 nurses, I just, in referring to the Pay Commission, want to stress they're completely independent and they comprise of 7 individuals with a vast experience of HR and IR in the private, public sector and in the trade union movement.
Thank you, Minister. The rest of your reply will be on the record. Deputy Shortall, 1 minute.
The difficulty is that the line from you, your department and government is constantly that there is no evidence of any difficulty in recruiting and retaining nurses. I mean, that's the line you're putting out there the whole time that is entirely unhelpful to the current situation and which flies in the face of the evidence before our eyes. And that's why I'm asking, why was it that, given that the HSE said difficulties in recruitment and retention pose a major challenge to their ability to actually meet the demand for health services? Now, they're the people who know. They're dealing with this on a daily basis, trying to find cover for their services, whether it's at hospital level or at community level. So they're the people who know. They have made that statement very clearly that this is a constant challenge to them. And why, in light of that, in light of the fact that we as a country are spending €2 million per week on agency nurses, why is it the HSE has to travel all around the world and is paying very substantial recruitment costs and still not managing to get enough nurses? Why are you in denial about that fact?
Thank you, Deputy Minister.
Actually, if you read the conclusion of the submission that the Deputy here is referring, the conclusion says that equipping the public health service with the required nursing and midwifery workforce is undoubtedly a substantial challenge. So the text that you were referring to here, which went into the Public Service Pay Commission on behalf of the employer, did acknowledge the challenges that are there. The conclusion went on, after opening the sentence that I just referred to the Deputy there, to say that the challenges here, and I'm quoting, collectively, these represent some of the greatest challenges faced by our health services, nursery and midwifery workforce. So it did acknowledge that there were challenges there. It did make the point, however, that these challenges are not generalised in nature and are concentrated in particular hospitals and in particular disciplines. And it also placed that in the context of, and I never heard Deputy Shortall say this, that we have been successful in recruiting more nurses and midwives, and we have a turnover levels that are comparable with the rest of our public service.
Final minute, Deputy Shortall.
If that is the case, Minister, why is it that on a regular basis procedures are cancelled because of a shortage of theatre nurses? Why is it that our child health programmes and our vaccination programmes are hopelessly inadequate in terms of the coverage as a result of lack of nurses, of public health nurses? I mean, this is the evidence that's before your eyes, and government continues to create this impression that there isn't a problem there, when we know that there is. Anybody who has any interaction with the health service knows that there is a serious problem there as a result of those challenges. And of course, the longer this goes on, the longer you allow a situation to continue where we are losing significant numbers of nurses, the heavier the burden on those who remain, and the more stressful that job becomes, and the more incentive there is for those people to move on also. So, Minister, look, this morning you said that you were genuine about engagement with the nurses. Again, I would ask you, will you ensure that people get around the table as soon as possible, and that they do so in a manner that is constructive, and that you remove any preconditions so that there can be open and frank discussions?
Thanks, Deputy, for your cooperation on time. Minister.
Thank you, and thank you, Deputy, for your questions. I repeat again that across the entirety of this document here, it does make reference to specific difficulties that do occur. In relation to the 2 points that you have said to me, yes, I do want to see another round of genuine and constructive engagement to try and deal with this issue. And secondly, the only condition that I have, and it is a vital condition that I maintain, is that any engagement that happens inside the context of the existing agreement that we have. The existing agreement that we have says that strike action should not take place, and it says that cost increasing claims should not be made. And clearly, those elements of this agreement are already being challenged. And as I said in our 2-hour debate on this issue earlier on, the consequences of this going wrong in a very disorderly way, if we cannot maintain a wage agreement in our society for our public servants, will spell even greater difficulty in the future for trying to maintain and improve services.
Thanks, Minister. No, sorry, time's not up. No, I'm sorry. I thank the Deputy and the Minister